Hi you guys, I'm back with another video. This video is pertaining my daughter's pyloric stenosis. So if you don't know what pyloric stenosis is, I am looking it up on mayoclinic.org just to give you a medical definition of it instead of for me, because I'm not a doctor. And it says pyloric stenosis is an uncommon condition in infants that blocks food from entering the small intestines. Normally, a muscular valve, pylorus, between the stomach and small intestine holds food in the stomach until it is ready for the next stage in the digestive process. In pyloric stenosis, the pylorus muscle thickens and becomes abnormally large, blocking food from reaching the small intestine. So some of the symptoms of pyloric stenosis are vomiting after feeding, persistent hunger, stomach contractions, dehydration, changes in bowel movements, and weight problems. So from my experience with my daughter, it started around maybe when she was like 2.5 or 3 weeks old. They usually catch it between like 3 to 7 weeks, I believe, because your baby just can't keep any food down. So with my daughter, she was throwing up after every feeding, and it was projectile vomit. It wasn't the regular normal spit up. It was shooting out of her mouth. Now it wasn't shooting like across the room, but it was shooting out of her mouth. And when she threw up, she was throwing up her whole stomach, and I could tell it was her whole stomach because it was a lot. Like, I held her in my hands like this, trying to burp her one day, so she's facing this way, and I'm holding her upright, and she vomits, and it got all on me, and then it got even on the floor. So my whole shirt was soaked, and then the floor, it was all over the floor. So she was vomiting after every feeding, and then she would be hungry, and then her bowel movement started to change, but she still was having wet diapers a lot. She was still peeing right, nothing changed in that. So, the first sign of dehydration is, or one of the first signs of dehydration is you don't urinate as well or as frequent as you should. So she was still having wet diapers. Now keep in mind that this is just my daughter, every person is different. But one of the first symptoms is the consistent vomiting, especially after every feeding. So when this was happening, I was just on Google, like, okay, what could be wrong with my baby? What could be wrong with my baby? First, I thought that it was her milk. So when I first noticed it, I changed her milk. She was on Gerber Good Start, and it's like the orange in the orange can, or with the orange on it. I changed it to Gerber Gentle Ease, and that's the purple. So just because I felt like she could be allergic to it, I felt like she could have really bad GERD, because their GERD can do that to the babies. So I changed the milk, and it's like it got better for maybe a couple of days, and then it got, it went back to the same. It didn't get worse, but it kind of did get a little worse. So, but it was still the same. It was nothing like, she wasn't throwing up blood or anything. She was just throwing up all her food. So, I made an appointment with the doctor, and by this time, so Ava was born 6 pounds 14 ounces. When I took her back to the doctor for her, it was a little after her 2-week visit. So at her 2-week visit, she wasn't doing this. But my mom had seen her do it maybe like once or twice, but I had never seen her do it, and until it was like that night or the next night. So it was just a couple days after her 2-week visit is when I first seen her do it. So I made an appointment. My mom and Ava went into the appointment, and the doctor was just like, we'll keep an eye on it and all of that. So by this time, Ava had only gained 2 pounds. So she was like 8 pounds, and I don't remember how many ounces by heart, but she had gained 2 pounds, which was still good by like 2.5, 3 weeks. And so the doctor was like, okay, we're going to keep looking because she's not losing weight, you know, and that's also a sign your baby's losing weight or a failure to thrive because they can't keep anything down. They're not eating, so they're not getting the nutrition they need to grow. So she had grown, and she was actually the same weight as when I took her to her official 2-week appointment. So the doctor was like, come back in a week, just make sure you're burping her good. We'll check on her then, and if she hasn't made progress, we'll go from there. So we went from there, and from the appointment, I that same day is when I changed her milk to the Gerber Ease of that appointment. So I was hoping, you know, that she would make some type of improvement. So that whole week I was just trying to get her back good on her milk. Because, you know, it takes a couple of days, maybe even a full 7 days for the baby to start digesting the milk and getting used to the milk good, and, you know, if it's a new milk. So, nothing happened, as I said before. So we went back for the appointment, and this time Ava was still the same weight. And so she said that was kind of concerning because they should be gaining, I think babies gain maybe like, I'm not sure, don't quote me, but maybe like an ounce or two a day, and she didn't gain any. So she said that she was going to send us for an x-ray of Ava's stomach to see, and she did mention pyloric stenosis, and I had read about it online before I even had went to the doctor, and so I was kind of familiar with it. They can tell if your baby has it by ultrasound. So she sends us to a whole nother part of the hospital, different hospital I think, and to get an ultrasound on Ava's stomach. And she said if it wasn't pyloric stenosis, she would treat her for severe GERD. So we went to the it was radiology in our hospital where we live at. And so they give the babies sugar water, just water with sugar in it, and just to see, it helps to see a little bit better. So Ava had not ate. She hadn't ate since earlier that morning, and by this time, this day, like the day that all this took place, she wasn't keeping anything down by that point. It was just, she wasn't keeping anything down. Sometimes she, like during the night when she would eat, I would sit up, burp her, and she wouldn't throw up. She would just spit up a little bit, but most of the time she was throwing up. She was throwing up a lot, but sometimes she wouldn't. But by this day, she was throwing up everything. So when I fed her the sugar water, she was so hungry that she was just like gulping it down, gulping it down, gulping it down. And she gulped it down really, really quick. So when she was gulping down the sugar water, the purpose is they'll see it on the ultrasound, and it actually looks like little, you can see it, and it actually looks like little, I don't know, like little dots. And the purpose of that is to see if it trickles into the stomach, to see the flow and all that. So it was barely getting into her stomach, like barely. And then Ava threw up. She threw up. It was the worst I've seen her thrown up. It came out of her nose, and it actually choked her. And it choked her so bad, like her eyes was bucking out of her head. Which was really, really, really scary. And I'm kind of glad that the ultrasound techs seen that, or somebody saw that, you know. The doctor was on it, but it's good to have somebody see that. It was just bothering her so much that just because it was coming out of her nose. So it probably would have been a little bit helpful to have one of those nose suction things to get all of that out of her nose. The nurses ran out to get somebody just in case we needed help, and like 3 or 4 nurses came in. But by that time, Ava was breathing good, and I just asked for a nose suction thing, and just to suction all that out of her nose so she can breathe a little bit better. And so she was like, the ultrasound tech was like, they're gonna show their the doctor, see what the doctor says, just wait right here. So me and my mom waited, and I was just still pretty shaken up because that was really scary. And so they put us in a consultation room, um, while we waited. And then by that time, I'm like, okay, you know, I kind of already knew what it was, because when you're looking at the ultrasound, nothing's moving in the stomach. It's barely trickling in, and I mean barely, like it's barely, nothing's going in her stomach. You can see it. So the ultrasound tech comes back and it was like, your doctor is gonna call you on. It had a phone in the room and a computer and like a TV in the consultation room. So she was like, your doctor's gonna call you, and just pick up when she calls or whatever, I guess. And then the doctor called me and was like, they were going to admit Ava because you know, babies just, when they see stuff like that, the babies are probably gonna have the surgery that day or the next. So by that time I knew they were in, of course I knew they were admitting Ava, but I was actually happy because it's just kind of sad to see your baby not be able to eat the way she wants to, or you know, she's not thriving like she should be. So we walk all the way to the children's hospital. We get settled in our room, almost like a maternity room all over again. And so I have like multiple doctors coming in talking to me, asking the same questions. How long has this been going on? What is she doing? This. They'll ask you just the same questions, just to get a brief rundown of everything that's going on. And they were telling me about the surgery, and I knew she would have to have surgery, and that was probably the scariest part, but I'll get to that in a second. So Ava, when they can't eat, when they are going to have this surgery, they can't eat just because they don't want it to they don't want the babies to throw up or anything while they're operating, and then it choke them or whatever, so they can't eat. So Ava, and they're also dehydrated by this point because they can't keep anything down. So Ava had to get an IV, like an actual IV. I didn't even know they gave babies that tiny IVs, but Ava got a IV, and they tried for forever, and it was heartbreaking to hear her cry because it was just like, it was so heartbreaking. So they tried in her arm, they tried in her hand, I think, and she was dehydrated, like I keep saying, so her veins were really dry, as the nurses were saying, she's dry. So they finally got one in her foot. So she was getting fluids, like a big bag of fluids. I don't think she got the whole bag though. I don't really too much remember. I know that she got what they call a bolus, and that's fluids like it was like a whole bunch of fluids all at once, like really quickly, just because they can't eat, and the fluids helps them, helps their hunger subside a little bit. So we had to stay there all day, and then her surgery was scheduled for early morning, the next morning. So we got admitted on a Friday. Her surgery would be Saturday morning at 6 or 7. So we were getting through the night. She couldn't eat, so she was really hungry, but she was pretty lethargic at that point, just because she couldn't eat, and she just slept basically the whole time we were in there. So they had what they called sweeties in the hospital, and it was just sugar water. So I would like dip her pacifier in the sugar water and put it in her mouth, or they gave me like little syringes to give her some sugar water just to keep her calm, and she was even throwing that up. She was even throwing the sugar water up, a lot of it, like all of it. Whatever I gave her, she was throwing it up. So we finally get to the morning. It's about 6 o'clock when they come and get us, and then I walk like to the whole other side of the hospital, and they are like, telling me about, once I get there, the operating doctors and the anesthesiologist were telling me about the surgery and telling me that she'll be put to sleep, which I kind of figured. It's like she just probably got like a mask over her face, and then she was out, and it was that. I think by that point I was really scared, of course, who wouldn't be. So, um, while one of the doctors were talking to me, Ava actually threw up again, and she threw up a lot. This was just the sugar water, so it was clear. So, they, prep me. They're just telling me everything, and it's a really, really quick procedure. It's just about 3 incisions. It's like I'm not sure if this was the worldwide technique. I'm just telling you how they did my daughter. Um, there was a line like in the there was three incisions, one at the top, one on the side, and then one through the belly button, and it's laparoscopic. I don't know if I'm saying that right. Laparoscopic. They go in with a light and they look at what they're doing, and they kind of cut the pylorus muscle, and just so stuff can get in because it's thick. So it's like stuff can't get in. They cut the entryway open a little bit, and then yeah, that's basically it. So they told me that they'll make 3 incisions, cut the muscle a little bit, and then a doctor said that he was like spraying water or did something to make sure that it flowed in her stomach correctly, and it did. Not spraying water, but he did something with some type of liquid to make sure that it was flowing in her stomach right. So they told me about the surgery, and then they took her. I went downstairs and got registered for like alerts. So the hospital that we go to, they give you like a pager, and it tells you, it updates you about your loved one, or like patients in OR, or patients doing good, or patient just started surgery. They have color codes, and they also have it up on the screen just to keep you updated, which I think is a brilliant idea, because my baby was only 4.5 weeks old, and I was terrified. So I got registered in the waiting area, got my pager, and then I went to the cafeteria to get some breakfast, and so I ate. And then when I sat down and started eating, which was maybe 30 minutes after they took her, they paged me and said patient is in OR doing great. And I was like, wow, I was pretty amazed at how fast things were going. So I ate. I took my time eating just to, get my mind off of stuff, call my mom, see where she was at. Finished eating. And then I just went back in the reception area, the waiting area, to wait on my mom. She got there maybe 15 minutes later after I got back from eating. And so by that time, it was maybe from when my mom got there, maybe I would say 15 to 20 minutes later, I got a message on my walkie-talkie, and it said, see doctor in the consultation room. So I flew back there. I flew. And the nurse had told me that's normal. The doctor would just want to talk to you when the surgery's done. So I flew back there, and it felt like eternity. He took forever to get there, and it just made me even more nervous. Like, I flew. I didn't even tell my mom where I was going, and she had to come and find me. She was like, I flew back there. So the doctor came in. He told me that everything went okay, and I was just like, I was so happy. So he told me that everything went okay. He drew a demonstration of how the surgery went, and all that good stuff. And so it was really quick. So if your baby does have to go through this, it's not long at all. It was a quick procedure. Quick. I think Ava had 1 stitch over each incision. Ava also had a hernia, and they fixed that while they was in there, which was wonderful. So we went to go see Ava, and as she was recovering, and she was like so cute. She was wrapped up in a little blanket, had little heart monitors on her, and she was just so cute. She was still sleeping, and she was like, her little cry was like, it was so different. Like, she was just tired. So when we got back in the room, they gave her, they started her off with Pedialyte to see if she could keep it down. And I think she had to keep down 2 bottles of Pedialyte, 2 ounces each. And then she could start on her milk, but she was eating every 3. They made her eat every 3 hours after that. So she was keeping everything down, and if everything was going good, we were going to leave the next day. So we got through the night, everything went perfect. She didn't throw up any, she was eating good, and then we got discharged. So everything has been okay since she's had her surgery. She's spit up and thrown up like a regular baby would. She's not projectile vomiting her whole stomach, and she's not projectile vomiting like curled old milk that just was sitting on her stomach, didn't digest. She just spits up, which is normal. So she's still spitting up, but she's spitting up like she should, you know, just because the milk is coming up. So the schedule, their eating schedule is really strict. It's for the first 2 days it was 2 ounces. After we got discharged, I'm sorry. So after we got discharged, it was still 2 ounces. So 2 days after 2 days later, it went up to 2.5 ounces, so 2.5 ounces. And then 2 days after that, it went up to 3. So a whole week after post-surgery, she was eating 3 ounces, which is what she was eating before she went in for surgery. So she was basically kind of grumpy like all the time just because she was hungry. So yes, she was eating good, everything was good, having normal wet and dirty diapers. So we took her back to the doctor a week later just to do a weight check. So a week post-surgery, I believe. Yeah. And so she was still the same weight. She hadn't gained any. So that kind of concerned me. So my doctor was like, we're going to see you in a week again just to see how she's doing. We took her back in that week, and she had gained a couple ounces. So that's really exciting. But yes, I just wanted to talk about this because if you think that your baby's not keeping anything down and it's projectile vomiting is always a sign of something, especially maybe once or twice or whatever isn't bad, but if it's happening after every feeding, you should definitely call your doctor. It could be GERD, it could be pyloric stenosis, and also pyloric stenosis is most common in boys. I have a daughter, and it's most common in firstborn males. So it's most common in boys, and rarely do they see it in girls. But also just know that if your baby is diagnosed with pyloric stenosis, it's quick. This procedure's quick, and they are really they happen often. Like the doctors in the hospital say they do one maybe once or twice a week. So just know it's an easy fix, and if you feel like something is wrong with your baby's vomiting and eating, get them seen by the doctor. Always trust your gut instinct, and yes, always trust your motherly instinct, and just go with your gut feeling. I felt like something was wrong with her, and it is normal for babies to spit up a lot. Some babies will spit up more than others, but like I said, it shouldn't be projectile after each feeding, and they shouldn't be throwing up their whole stomach. They shouldn't be throwing up, because baby stomachs they're not that big. So if it's a lot of throw up, then that's a concern. So thank you for watching this video. If you have any questions, just drop them down below. Like, comment, subscribe, share, do all that fancy stuff. And thank you for watching.